Hello, I'm Matthew Weinstock, Managing Editor for Modern Healthcare. Thanks so much for tuning in to the latest edition of The Checkup. Throughout 2020, we know that healthcare leaders have been talking about the need to pay more attention to systemic problems that continue to disproportionately impact populations of color. Leaders at Novant Health in North Carolina really put those words into action last year. The organization launched several initiatives aimed at helping staff and the community deal with the impact of the coronavirus pandemic, to talk about racial injustice and a whole lot more. I'm really pleased today to be joined by Tanya Blackmon, who is Executive Vice President and Chief Diversity, Inclusion, and Equity Officer at Novant Health, to talk about the impact of those initiatives and how they've rolled out. Tanya, thanks so much for being with us.
Thank you for having me, Matthew.
So I want to start by talking about a program that you guys launched, I believe last year, right, called Thriving Together, where you tried to reach out to staff about wellness and taking care of themselves. You had, I think, about 26,000 requests for about $9.4 million in money that rolled out to some of these staff members. But can you talk about that program, how it came about, and what the results have been of it?
Yeah, when you asked me that question, Matthew, it made me think about Maya Angelou's quote. People will forget what you said, they'll forget what you did, but they will never forget how you made them feel. And for us, particularly during a time of crisis, it's so important that our team members know that we care about them. And so as we started looking at this, it was a collaboration with our wellness officer, employee assistance program, spiritual care, lots of people that we came together and said, we really need to make sure that our team members know that we care for them and that they have the resources and the tools to use without having to look very far. So some of the things that we did, we created a hope fund where we put $11 million in a fund, and part of that money was from the executive team members out of their personal pockets. But we put $11 million in a fund to help team members who were financially needy or in need of assistance. And we've given out, let's see, from that, we 11 million initially, but the foundation raised about 2 more million. And so I think we have about 4.7 million left over. So we've been really very generous in giving out dollars to help our team members. Of course, they have to meet certain criteria, but they have said to us, this has helped us. This has gotten us over the hump. We find that team members, spouses or significant others have lost their jobs. We did not furlough anyone, but sometimes hours were cut. Children are at home and they're needing to eat more. There's more electricity being spent. There's the internet. So there were a lot of things out of team members' control. And so we felt like this was a way to help our team members through the financial fund. We also did a lot of work from an emotional standpoint. We know that COVID-19 has lasted for a very long time. And so emotionally, it takes a toll on you as well. So we have our employee assistance program. We have now emotional health advocates who are actually been trained as peer support people to help our team members who are stressed. So we really think about a lot of things. Our spiritual care team conducts co-lavender for the whole team. That's really like a psychological first aid. It's a real sense of calmness and a time to reflect and to really kind of take care of yourself at that moment.
And Tanya, how are you getting the message of this program out to employees? How are they finding it? And it sounds like you're getting a lot of response to it.
We are getting a lot of response. Well, for the Thriving Together, we actually created a platform with our marketing team. We created a digital platform that team members can go to the intranet, and there are 6 buttons they can click on depending on what their need is, whether it's emotional, spiritual, financial, physical. They can click on those buttons and the resources pop up. So they don't have to go very far. It's right there. It tells them how to get connected. For the Hope Fund, there's also a way that they apply for the Hope Fund online. And that comes directly to a team that's making decisions about how much people get from the Hope Fund.
Got it. I want to pivot a little bit from the pandemic to, I know one of the other areas you focused on was the civil unrest that we saw during 2020 and the focus on social injustice, structural racism. You were running some, I think you called it Courageous Conversations, if I have that right. Can you talk about what you've been doing at Novant to address that that issue that we saw really come up under the spotlight in 2020 as well.
Yeah. I'll start a little bit, talk a little bit about when Novant Health actually made a commitment to embed diversity, inclusion, and equity into the system. Our CEO made a decision. When he asked me to take the role, we really talked about what that would look like. And we made a decision that for us, diversity and inclusion is a core value. And when equity is important in that as well, that we were not interested in creating programs, but more of a culture change strategy. So as we did that, as we've been doing that for the last 6 years, when the social unrest or the social injustices happened, we were right there in the moment with what was happening in our country and what was happening with our team members. We had something called Zoom chats where we had courageous conversations. And our Zoom chats really are a safe place for our team members to have dialogue, to share their thoughts and feelings, to listen and understand the perspectives and experiences of others. It's not a debate session, but it really is a way to have dialogue so that we can really understand where people are coming from. You know, I think we all shape our own life experiences, and that's how we see the world, by what we've experienced in life. And sometimes we need to hear that from others so that we know their perspective as well. So we've had several of those. I think if I count total participants, and that's including live participants and people that have viewed the Zoom chat later, we've had about 13,000 people who've been involved in our Zoom chats. They're able to have conversations with each other on Zoom that they may not have had by themselves. We also have a way for people to have tips. We give them tips and tools on how to have conversations across differences. In one of those courageous conversations, Zoom chats, our CEO and I had a courageous conversation about our similarities and our differences and how we come together to really create the magic. I call it the magic at Novant Health.
That's great. We'd love to see that. We'd love to watch that video. I'm curious, as you think about that magic, that those conversations you're having, how does that translate then into the patient care piece of what Novant does? So obviously you're dealing with this internally with your staff, with your colleagues at the C-suite level. How does that then manifest itself on the patient-facing side?
Yeah, thank you for that question. Actually, everything that we do all of our roads lead back to our patients. We are reflective of our patients in the community. And so when our patients come into the system, if we've done a great job as team members to understand each other, our similarities and our differences, and really value each other for our strengths, then when we have patients that come into our system that reflect who we are, we're better able to take care of them. You know, I think it's really about diversity and inclusion and equity really is about people. And so you want to be able to understand people better than anybody else. So the more we educate ourselves, the more we take care of ourselves and understand each other, the better we can understand our patients who come in, and they all have unique needs. No patient is the same. They come from different populations, different countries, different environments, different socioeconomic statuses. Some are male, some are female, some are transgender. There are lots of differences in our patients. So it really makes sense that as a healthcare organization that you know that, you understand that about your patients. And I think it starts inside, it starts with us.
Right, sure. I'm curious too, as you said, you've been doing this for about 6 years. You know, health systems are struggling right now financially, given the pandemic and everything that's been going on. How do you sustain a commitment to diversity, equity, and inclusion when you're also dealing with, you know, some financial challenges across the delivery system?
Yeah. You know, during a time when you have financial challenges or any other challenges, you really need to do more, not less, when it comes to diversity, inclusion, and equity. As I said earlier, it's really about people. And what we've done as an organization, and I credit our president and CEO for this, he really sees, and the whole executive team sees diversity, inclusion, equity as a strategic lever. And when you realize something is a strategic lever, you don't let go of it. It cuts across every fabric in your organization. So from a financial standpoint, we use this lever to help us grow our market share, to help make sure our patients are satisfied, our team members are engaged. So we don't see it as something separate and apart. It really is interwoven into everything that we do.
Got it. I want to pivot a little bit to talk about women leaders. You have been named to Modern Healthcare's top 25 women leaders in healthcare program. So for 2021. So congratulations to you for that.
Thank you.
Yeah, you've done a lot of impressive things there. I know you're working on a program, or you have an initiative to promote women throughout the organization. One, the acronym is LIFT, where, if I understand right, about 30% of the women who've gone through that end up with some sort of a promotion or a job advancement. Talk about what you're seeing in terms of female leaders within Novant, and what kind of gender equity you're trying to achieve in the system.
Yeah. Well, it's really interesting. When I started this, when I took this position, I did a listening tour across our organization, and there were I listened to the voices of 700 people, so I heard a lot. And one of the things that I looked at in looking at our data is that our organization, and probably like a lot of other healthcare organizations, is 82% female. And so when we looked at that, we realized, though, that 82% of the leadership was not female. And so we started looking at, what do we need to do in our system to make sure that we are recognizing and strengthening the women in our organization. So we created a program. I did it with co-chair it with Dr. Cherie Gregory. We created a program called LIFT that helps to develop women who are high potential performance type women in the organization. And we make sure that there's education related to executive presence, communication, working across the system are really things that are important. And what we have found in this program that is a little unique from some others is that we give each woman that graduates from the program a sponsor for 6 months. And why that's important is because I think more women need sponsors. Mentors are great. They support you, they guide you, advise you, but sponsors really speak on your behalf when you're not there. So that's been a really a big component of our program. And yes, several women in the program, 30%, I think it was probably 45% actually, but 30 to 45% of the women in our program end up having a larger scope of responsibility, or they've been promoted. And I've been really excited to hear my male colleagues say, Tanya, when we interview someone who's gone through the LIFT program, we can see a difference. And we think that everybody should go through the LIFT program, including the men, because of their presence, because of how they communicate. Their confidence level is very different. And so we've really been proud to be able to lift the women in our organization.
It's an interesting idea, though, because we've heard that elsewhere too. That idea that men really need to go through, male leaders need to go through some of these programs as well. Have you thought about doing something like that to help them understand what it may take to create a more diverse C-suite?
Yeah, well, interesting. We usually have at the LIFT program, we have thought about it. What we did about a year ago is we brought the male sponsors and the participants together and really talked about the differences in gender and how do we really support each other and work together. We are thinking about how do we do that in an even more formal way. At every LIFT graduation, our president and CEO comes and spends like an hour with the LIFT participants, and they're able to ask him questions. They ask him questions like, what could we do more? One thing that I thought was really interesting that he said was, when you're invited to a meeting, he said, you're invited to the meeting for a reason. So put your voice in the room. And that really helped our female leaders who are introverts in thinking about, then how do I make sure I do that? And so we've given them tips to do that. For example, we've said to them, if you're an introvert and you don't feel like you want to just kind of jump out there, think about before you come, what would you want to ask? You may even want to go first. You may want to summarize the meeting at the end and pull all the information together. So there are lots of tips that we work with the women on in LIFT to help them continue to be successful and to be confident in who they are.
That's great. And lastly, Tanya, here, if you think about where we are where the industry is in terms of, with female leadership, there's still a dearth of that. So what would some of your recommendations, your top 2 or 3 recommendations, be to your peers across the industry about trying to create more diversity within their C-suites?
Yeah, one thing I look at is, and I said this during the crisis too, when you're pulling people together, look at who's on your team. I'm always looking at what voice is not here that I need to leverage. So if the female voice is not there, I'd say make sure that you're doing that. I think closing pay gaps are really important to do. I think flexible hours and policies and procedures that would help women to be in the workforce and to continue to excel in the workforce. One that we put in place was paid parental leave. We had maternity leave. It was not paid unless you had your own paid time off or your PTO, but we put into place parental leave, and it's paid. That really has made a difference. Giving women supports, groups. We have a women's business resource group that really is a network of women for people to have a support at work. So those are some of the things I would think about would be important. And the one other thing I'd say is looking at your slate. When you are recruiting, make sure that you have a diverse slate of candidates that includes women on that slate.
Right. Well, Tanya, we appreciate you taking some time. You're doing a lot of really interesting things there at Novant. We'd love to stay in touch with you on some of these things as they unfold. Again, congratulations for being part of Modern Healthcare's top 25 women leaders in healthcare as well.
Well, Matthew, thank you for having me, and I am honored that you all have chosen me. Thank you very much.
Thanks so much, and stay safe. And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.